Good afternoon and welcome to Harvard Chan Studio. I'm Andrea Baccarelli. I'm the Dean of the T.H. Chan School of Public Health. And today I have the great pleasure to have a conversation with Dean Megan Ranney, Dean of the Yale School of Public Health and a physician, researcher, and a public health leader. Megan, welcome.
Thank you, Andrea. It is a joy to be here.
Fantastic. So I'd like to start with demystifying leadership.
Okay.
What leadership looks like and what looks like to be a dean? Can you walk us through what looks like one of your days?
So I will start with kind of what a dean is and what we do. I think that when I was a student or even just a faculty member, I had absolutely no idea what my dean was other than their title. I think of my job as dean as being in some way the kind of holder of the hopes and dreams and structures and systems of my school and its intersections with other structures and systems within my university and the larger world. Sometimes people talk about a dean as being a CEO or a superintendent. I don't agree with either of those descriptions. A school is not a business, as any faculty in the audience know, right? It's a bunch of individual projects, and my goal is to make it easy for you to do great work. We're not a superintendent either, because although education is clearly a huge part of being a school and of a deanship, right, our work is much bigger than just thinking about the structure and of our teachers and support staff, although that is part of it. So I think of it as a kind of that holder of hopes and dreams. And then within that, what does my typical day look like? Gosh, there is no typical day.
Yeah.
What does yours look like, Andrea?
Some are great.
Yes.
Some are even better.
So there you go. I like that. I mean, right, it's anything from meetings with individual faculty, lunches with students, meetings with university administrators. Obviously, today I'm up here in Boston, and I've gotten to meet with folks from a wide variety of different sectors, as well as a lovely lunch with many of the faculty and students here. So every day is quite different. They are often long, and then I'm still an emergency physician, and so I do still add in clinical work, not as frequently as I did pre-dean life. It is certainly not first, second, or third on my list anymore, but I do still work clinically, and then try to also be a good parent and wife. So that's at the I hate to put that last, but that does become part of it as well.
Yeah. And so you spoke about being the holder of the hope of different people, different groups, and clearly part of our jobs is that we meet many different people, many different constituencies, some that are completely aligned with our visions, our passions, our interests, some that might disagree with us and may perhaps even we disagree with. So how do you interact and speak with different people, including people that might have different opinions on our work?
So, I mean, the first thing is that I welcome the chance to have discussions with people who may not automatically believe that what I do is important or that any of us do is important. I think it helps to sharpen, just as to the scientists in the room, when we go to a conference and we defend a paper and someone asks us difficult questions, it sharpens our science and our argument. I feel the same way about having discussions with people who may have different worldviews, different value systems, different estimations of whether what I do is a good use of time. So I love those conversations. And I actually think that part of my job as dean is also to help shift people's understanding of what public health is and what we do and why it matters to the health of communities. So it's not just interesting to me from an intellectual and a day-to-day perspective, but also I think that is fundamentally part of my job as dean.
Well, that's really interesting. And maybe moving a step forward, you spoke about your communication with different groups, but I think it's clear to all of us that communication has become a core skill for everyone working in public health and perhaps for everyone living on this planet at this moment. But how do you think about bringing these skills to the classroom? I mean, what our students and our graduates need today?
In terms of communication skills? So I do think that communication is a core part of our skill set, and I would argue that that has in some ways always been true, right? When you and I got our training, we learned how to communicate in certain settings, right? We learned how to write an abstract or a paper. We learned how to give an oral presentation, right? So there were parts of communication that we learned over the course of our graduate school training. I think what we didn't learn traditionally was the importance of communicating not just within our own circles, but also communicating with folks who, again, may not identify as scientists, as academics, as anything related to public health. And that skill set, that lack of a skill set, I think has hurt us both in public health, but also in higher education in general. We have assumed that the value of our work will be appreciated whether or not we talk about it, right? In fact, humility is a core virtue of ours, and we don't love it when people brag about their work. So we were in some ways dissuaded from communicating with the public. I think it is long past due for us to change that. So how do we bring it into the classroom? I mean, I think we actually bring it into the classroom by starting by bringing it into our faculty practice. I think it is impossible to tell students that they should be doing something or learning something that we are not comfortable doing or learning ourselves. So I think step one is actually thinking about how we train or facilitate our faculty engaging in communication in whatever way they are, and we can talk about how I define communication,
Okay.
but faculty first, and then having the faculty who are most passionate, who are most skilled, who have the most theoretical but also practical knowledge, then creating spaces for students to learn about communication. Some of that is formal classroom work for some people, but I think it needs to be a through line throughout our training. We would never say that, again, you learn how to write a paper through one class. Similarly, you cannot learn how to communicate about your work, how to use your work to help create the healthier conditions that motivated you to go into this field, right? You can't learn that in just one class or one seminar. So it needs to be throughout.
So you mentioned that you wanted to define communication. I'm curious, how would you define communication?
So I think of communication as being really the process of both talking about what we do, but also listening to what people's concerns are and their perceptions. I think too often communication is thought of as being something we do at or to people, and it's not. It actually starts with hearing and understanding. And it can take then a variety of different forms. I think also often we think about communication as being on broadcast media or writing an op-ed, and that's part of communication, but it may also just be having a conversation in the line at your grocery store or over Thanksgiving dinner, or maybe if you are someone who likes Instagram or TikTok, right, creating a reel or a story that helps share your excitement or the impact of your work. So I feel like often we box in the definition of what communication is, and again forget about that first step, which is listening. I will say, Andrea, we actually developed a whole course at our school at Yale that our incoming master's students all take part in. We call it compassionate dialogue, but it actually starts with active listening. And so the first mandatory portion of it is teaching them how to listen, because I feel like you can't ever communicate if you haven't heard.
And that's incredibly important, because I think when we think about communication, we see it as a one-way street. And if I can say, perhaps it makes it also less intimidating, because and more fun also, because you can listening is a skill by something that it seems easier to do.
Yeah, I mean, I think
though I'm not sure it is.
Yeah,
but also it's fun. I mean, you can learn, and there are plenty of behavioral studies that show to us that we love our jobs when we learn. much more than when we are in a position of telling people what to do.
I love that. I'm going to add that in to
Okay.
when I talk about communication. Thank you.
And something else that related to this, I mean, I think how do we bring, which is related to listening, how do we bring evidence out in the world in a way that we fulfill our mission, which is to bring science into the world and to help science shape decisions and practice and behaviors. Mm-hmm. But how do we do this without dictating or without perhaps being patronizing people? Mm-hmm. I think sometimes we talked and we had a conversation also before about the boundaries of research, translation, advocacy, and activism, perhaps. Mm-hmm. How do you think about this spectrum?
So there's a couple of parts. We actually have the translation of outstanding science into real-world impact as our first strategic priority at Yale, and I think about it as sitting in policy in the private sector, but also very, very much in work with communities. And I think that part of it is one that underlies whatever we do in policy or in the private sector. And so when I think about the process of having our work go out into the world, we have to start with, how did we do our work in the first place? Was it co-created in some way that gives it validity and interest to the communities in which we are wishing to share it? If I walk into the Harvard School of Public Health and say, I did this study on you all, and I found this thing, and I know exactly how you need to change, I guarantee that, and I know some of the faculty in the room, you're going to look at me and go, Megan, did you talk to me? Right? So that same thing is true when I think about doing work in community. So if I'm doing research on environmental determinants or drivers of health, and no one in the community has had a say about what they're worried about how you're collecting the data, if they've not had visibility into how you're interpreting it, why would they believe it and use it on the other side? And then if I go to the policymaker side of things, right, you go and you sit down at some policymaker's desk or with their staffer and you hand them a memo talking about this amazing research that you've just created. And they're like, boy, oh boy, this is not number 1, 2, 12, or even 100 on my list of priorities right now as a politician. So you need to think before you even walk in that door about what their priorities are and how to translate your work into something that matters to them. So to me, that's how you get our work out into the real world, is by, it goes back to relationships and paying attention, right? That's why we're here, is to make the world healthier. So which parts of healthier do people care about? And how do we, again, co-create that science with communities, not trying to fully hand off our scientific methods, but making sure that folks understand and care about the work that we're doing.
And that's really interesting to hear, because lots of us who work with communities doing research in partnership with community, over the past 10, 20 years, we have all shifted our approach, where we co-create research with the communities. And it's interesting to hear this applies also to communication.
I think it does, because then, and I'll give you one example from, so it's co-creating the research, but also thinking as you mean to go on, in terms of the fact that when the study is done, it should have a life after you've, right, the end of the research is not the publication in the journal. The end of the research is when it's used. Again, whether it's being used by a community group or by a policymaker or by a company that may be able to use it to make their products safer or healthier, or to change the way that they design something, right? That's the goal. And I think often we forget about having that be part of the plan from the beginning. So I'll give you a very distinct example. Many of you in this room know that I do a lot of work around firearm injury prevention or gun violence. And am just finishing a study that was funded by the CDC in partnership with 4-H Shooting Sports. So 4-H, for those who did not grow up in an area where 4-H was common, is this amazing national youth leadership organization and mentorship organization. Kids that participate in 4-H have much better educational outcomes and health outcomes long term than kids who don't. And we worked with 4-H shooting sports to consider how we could talk about how the kids in 4-H shooting sports, who are leaders in their communities already, could understand and potentially be empowered to act on some of the markers of risk for types of firearm injury. So for example, to notice if a kid was depressed and at risk of dying by firearm suicide. We've done this study. The study itself has strengths and weaknesses, but from day one, we had 4-H shooting sports folks not just as part of the study, but also thinking about when it's done, if we have positive results or negative results, or if there's something in, parts of it are good and parts of it aren't, what will our next steps be? And now that the study is concluding, we have 4-H on board in terms of thinking about adaptations of the curriculum that we developed and eventual dissemination. So that is communication in a way, but it's also just thinking about the work that we do and how we put it into practice in a way that I think we are often not incentivized to do in academia.
That makes a lot of sense, and also I'm really energized because one of the buzzwords we have used here at the school in the past year is accessibility, which really means tearing down the walls and having us having access to the world having access to us. And this sounds, it's a framework that really resonates with our culture. And so something that's really interesting. I mean, I trained in medicine. I trained as a physician, as you did, and I had to say, and this was in the past millennium, so it's
Me too.
world have changed. The things have changed, but I entered medical school and I got past midway medical school without knowing what public health really was, let alone people who might not even be interested in a biomedical training. And clearly now, and I think this has been like this for the general public for many years. I think 2020, the pandemic changed because public health was on the headlines of every newspaper. So we moved from people not being completely aware or not fully aware, or perhaps not being aware at all that public health even existed, to people being very aware that public health existed, but perhaps still not understanding what it's about. So how do you see this? Does public health have a branding problem?
It's great. I'll sometimes joke that my parents were very proud that I became a physician, and then when I decided my world was actually public health, they were like, "And what is that exactly?" And then after COVID, they're like, "Oh, it's masks and vaccines and mandates," and I'm like, "Oh no! Like public health is so much more than those things that we saw on TV during COVID." So, I mean, yeah, to some extent, we have a branding problem because folks don't understand that what we do, it's actually a discipline. It's a way of thinking about the world. It's a way of diagnosing health problems in communities and then going through a series of scientific steps to figure out what will work to fix them in partnership with community. So that is a branding problem, and there's work to do. But I also hesitate to say we have a branding problem as if it's like totally our fault. I want to just say out loud that there is a misunderstanding or distrust of a lot of things in society right now, not just public health and health science, but also the media, Congress, higher education, the courts. I could go on. I think it's difficult to identify an institution that does not have a branding problem, and so I think the problem is actually deeper than just branding. I think it's about making tangible why what we do matters to folks that are not part of our world. Or maybe even making clear why what we do matters to people who are part of our world, who may not fully understand, looking around this room, right, what a health policy person and an environmental health person does, why that matters to each other, and kind of So I think we do have work to do, and I don't want to put it entirely on us.
So from what you say, it's almost feels like the part of the issue is really to find a common ground for communication, and you can put me environmental health and you health policy, and or anyone else. I don't want to create a divide if it doesn't exist. But what is that makes communication possible between people who are different, even within our own schools?
I mean, I think it does go back to that kind of idea of listening first, makes communication possible, and a sense of mutual respect, which may or may not always be present. Here I actually call a lot on my practice as an emergency physician, where my job at the bedside of a patient who most of them I've never met before, a few I have, but the vast majority of them, it's their first time encountering me. My job is to listen and to understand and to get them to trust me enough to share whatever is going on in a way that I can make sense of and act on. And I try to bring that same, I think it's that same skill set when you think about sitting down with people and creating trust. It's you start with listening and reflecting and respect, and then you try to have a conversation, and you may start in places that are less risky before moving to the ones where there is greater disagreement, and you may find that you don't actually ever have agreement on some things, and that's okay. I mean, I don't know, are you a Bayesian or a frequentist? If I put you in a room, I don't know that I will ever get you to agree. That's fine. And the same thing here. I don't have to agree with people that I'm in conversation with on every topic, but I need to be able to talk to them.
That makes a lot of sense. And related to the branding discussion, I mean, part of what we do, and this is something we live next to a medical school, and what doctors do, and we have this double agent life that we can relate to. What doctors do really is visible. I mean, you have an injury, you end up in the ER and meet Dr. Ranney, and you get your leg fixed or your cast. Yeah. So you get out, and also your family sees that you met a doctor. A lot of what we do sometimes is invisible. I mean, we are happiest when disease doesn't happen. Isn't that part of the challenge of communicating public health? It's
interesting. I mean, that's right. If I call up our peer school of Hopkins, right? This is they did a whole documentary around, and I'm going to forget the exact name, but around kind of the invisible influence of public health. I think that's part of it, but I mean, much of what people do is invisible. I mean, I don't necessarily see on a day-to-day basis what teachers are doing or what manufacturers are doing. I mean, I buy products, but I don't think about the people that are making my cell phone or my glass of water. So I think sometimes maybe we fall back on invisibility as a excuse rather than thinking about how do we tell a positive story about why our work matters. And to me, that's partly about moving beyond the idea of a negative connotation. Our job is to keep you from getting sick, and instead talk about the ways in which we support you and your family staying healthy, right? No one hesitates about engaging with wellness influencers online or in person. Everyone is seeking ways to be healthy. I think we are ultimately, that is our job. That is what motivates us in public health, is trying to help people achieve health. And so giving folks some agency in that and a reframing of what we do may be part of the answer.
That reminds me of a line that one of my mentors, always Dr. Linda Fried, one of the most renowned geriatricians of the past 50 years, always said that we need to move away from thinking about disease to think about health. Because I think all of us want to be healthy.
That's exactly.
And that doesn't mean just not being sick, correct?
That's exactly. We all need to be healthy, and it takes the public, right? I think the other thing that distinguishes us is that we do think in terms of systems and structures and communities, as well as on an individual level, and making clear the way in which the places that we live, the systems around us, the structures of insurance help us to achieve health or not. That becomes another place that I think people can get excited about and motivated about, particularly if we give them tools to improve those systems.
Absolutely. So I would like to shift gears a little bit. And I mean, when I met you the first time, I had a feeling of having a colleague, a person who's very happy and very, very excited about public health and the job you do every day. So a lot of our audience is made up of students and early career professionals. So may I ask you what inspires you every day? Where is the root of your enthusiasm and your joy in your work?
Oh, gosh, that's a very philosophical question. I mean, I will say quite honestly, the students are a huge root of my enthusiasm. It's why I have chosen very intentionally to stay in academia rather than moving into any of a wide variety of other careers that are open to someone with public health and medical training. I am here because I love our students and because I have seen over and over again the ripple effect of goodness that is possible for the world when great students are unleashed to go do awesome things. Like, my greatest pleasure is my mentees coming back and telling me about their achievements or their challenges or their successes, or just filling me in on what they're up to in the world. And so that is certainly part of it. But I also think, Andrea, that part of my optimism is, okay, I'm going to say, I studied as an undergrad history of science here. And so I go back to, not at the School of Public Health, but here at Harvard. And I go back to that history as something else that gives me optimism because, not to get cheesy, but when you look at history over time, there are always periods of chaos and discontent. But then you watch people who have agency and create change in really amazing ways, whether it's discovering the circulation of the blood or the effect of hand washing or the development of nursing as a profession or injury prevention and worker safety, and I could go on. Those all started with a small group of people who did some science and created some systems and created coalitions. And so I think the other thing that gives me optimism is that I actually have a very deep belief that we can create a better world. And I don't know when we will see that, but I do know that the way that we get there is by us continuing to both think rigorously, but also think in community and then commit to action on the other side. And one of the things I love about being dean is that I have the opportunity to create conditions in which others can do that too. So that's actually ultimately, like from a philosophical standpoint, what gives me optimism.
From a philosophical standpoint, I think I fully subscribe to your point of view, because I think it's also my own source of optimism. I think it's not just philosophical, because every day we meet amazing faculty, amazing students who is not just the purpose in the future, it's happening.
That's right.
I mean, I going around the school and meet people, students and postdocs and staff that might be finding new ways to treat malaria or new drugs for cancer or new ways to decide whether gene therapy is cost effective. It's a pleasure to see.
That is.
I mean, I think we have the best job in the world because we can witness all of that every day.
Some days.
And then the other days are better.
Yeah.
So I would like to perhaps get to a second part of this question. Always talking to our students and early career professionals, many of them are working toward a public-facing role. What does it mean to be public-facing today?
Gosh, another kind of philosophical, how do you define public? I mean, I think there's a variety of ways that you can think about public facing. Actually, as I say this, I notice a mentee in the back, so hi. There's a variety of ways that one can think about public facing. I think that it can be public facing in terms of, again, those conversations that you have in your community groups or in your faith community. It might be public facing in terms of a willingness to do interviews with journalists, either for print or for media, or it might be public facing in terms of the way that you engage on social media. But I think that ultimately public health is about the public, so in some way you need to be engaging with the public, even if it's not, one-to-many communication. There needs to be some aspect of your work that is public facing or at least public engaged.
That's really fantastic. And one additional question, I don't think you can go through a panel these days without getting this question, but actually it's interesting.
Now I'm waiting.
Because it's interesting because I just heard from you that one of the 4 core areas of the Yale School of Public Health under your leadership has become technology for public health, including artificial intelligence. And I was wondering whether, based on the conversation with your faculty that brought to your strategic planning and your own experience, how do you see artificial intelligence and new technology changing how we do public health today?
So I think in some ways, artificial intelligence writ large is an extension of what we have always done. I mean, I trained before we had R or Python, right? We have learned how to use new technologies forever to facilitate our work, to make it easier, to make it faster and more efficient. And so in some ways, I think of AI as facilitating that. We're working on this lovely public-facing health information data kind of data system called PopHive at our school, and AI has been tremendously useful in terms of helping us ingest and organize the data far more quickly than we would have been able to do even a couple of years ago. So that's one side of how I see AI influencing, is it will make many of these tasks simpler. Now, that doesn't mean students don't have to learn how to do some of the basic stuff that we've all done, right? I calculated t-tests by hand in my biostats course, even though we did have Stata and that, right? So you still need to learn what goes behind it, but I think that it makes our work easier and more efficient. I think there's another way in which AI influences public health, just as a shift in the conditions of health. We're actually doing a lot of kind of conversation and thinking about how, in some way, access to AI, and there's various forms of it, from LLMs through generative AI, right? How access to AI may actually serve as a driver or a determinant of health. So I think that's going to change public health, because it's another thing out there in the world, another condition that changes how communities access health and experience it. And then there's a final version, which is a kind of negative and very nihilistic view, which is AI has the potential to create huge public health problems that we can barely imagine right now. And we have faculty, and I'm sure you do too, who are thinking about the potential of AI for generating a next pandemic, the potential of AI for seeding division and discord and conflict, who are thinking about the ways in which genomes may be able to be modified. Those are some very scary versions of how AI may affect public health. At the end of the day, I think our job in schools right now is to teach our students how to understand some of the technical underpinnings of the current systems, but even more so to teach our students how to think about kind of those ethical and humanistic implications. How do we think about fairness? How do we think about what we engage with and what we don't? How do we think about the risks and benefits of using AI for this particular task or project? How does it potentially create new scientific integrity problems without us intending for it to? Like, that to me is, we're not going to be able to teach you guys the latest and greatest thing because it's changing too quickly even to update a syllabus, but we need to teach our students and ourselves as faculty how to think about how AI is being used.
Thank you for that. So I finished my questions.
Oh.
But we have some from the audience.
Awesome.
They were submitted in advance of our chat. So
Okay.
I'm going to read them out.
Wonderful.
So the first one is from Malia, who is a legislative aide in Hawaii.
Ooh.
And it goes back to our conversation about communities and how can public health efforts and strategies be more community-based?
First of all, I'm jealous, Malia, as we sit here in snowy Boston, that you are in Hawaii. So I have a very great answer, which is we can all move and help you in Hawaii. No, but how can it be more community-based? I mean, I think it starts during our educational process and making sure that all of our students have the opportunity to sit with and work with communities in whatever way you define them. We have the applied practice experience, of course, but that can mean a lot of different things to a lot of different people. So thinking about ways in which we can make sure that we are part of the communities that we care about, that's the starting point. Then I think that we can build structures into the research that we do. Think about having community members be co-investigators or consultants, actually valuing their time and expertise. Community members can and should be part of the legislative process as well, and ideally work side by side with us. And one thing I want to say as I think about kind of, there's not one definition of community either. And I think often when we talk about community, we talk about, being here in Boston, people say community is some sort of code for certain zip codes or neighborhoods within Boston. I will urge us to think about community far more widely. Right? It's about historically marginalized communities, or it's also about historically marginalized topics. It may be about communities that are not geographic, right? It might be communities that we identify in terms of, again, value systems or professions. There's so many different ways that you can think about what a community is that you work with, and I urge us to expand our thinking about what it means to say that we are working with community. It might be real estate developers or building construction companies, right? That can be a community too. So to me, when she asked that question, it begs that question of what does it mean to her to have community more involved, and then thinking about what the incentives are for them to feel valued and like it's worth their time. Something I frequently hear from partners is them saying, why should I donate my time? You're getting paid, right? At the end of the day, I'm making a salary. Why should they give their time to help what's perceived as helping me? And so how do we make folks feel that, and not just feel, but actually be equal partners at the table?
So there is a word that comes to mind. I want to go back to being philosophical. That we haven't said, but I think it's a thread throughout your thinking today, which is humility. I mean, when I hear you, even now that you're talking about communities, it made me think that all of us need to have the humility to understand that we don't know the audience we are talking about. We don't know the community we are working with, and we want to have the enthusiasm and humility to learn all the time what are their aspirations, what are their problems, what are their challenges, what are their desires, what is their thinking. I don't know whether that makes sense.
I love that. I hadn't thought of that, Andrea. I think that is a beautiful value for us to hold. Because at the end of the day, we will never fully know the answers to anything, right? Science is always a process of approximation of the truth, and the science that we engage, the questions that we engage in, the way we gather data, the way we interpret data, is shaped by the structures and the culture in which we live. So something that we think of as true today may shift a bit, right, as time moves forward. And as I look at my fellow physicians in the audience, right, we think about the ways in which some deeply held practices are now looked down on. So I think there is a sense of humility in that, of not, and maybe that's a source of, if we go back to your branding question, maybe not just for public health, but for academia in general. I believe so deeply in what we do and in the importance of defending the value of higher education, in creating great thinkers and doers. And maybe humility needs to be one of our core values in that we embody as well as talk about in what we do.
We have another question, though we are almost out of time, from Melissa, an assistant professor in Georgia. How can those of us in academia continue to inspire and encourage our students to pursue careers in public health when public health infrastructure is being gutted?
Well, a lot of infrastructure is being gutted right now, not just public health. So I will sometimes say half-jokingly, nowhere better to be than as a student while we figure out what the next version of the world looks like. But I also think that public health is foundational to a healthy society, and I have zero doubt that the skill set that our students are learning right now has value today and will have even more value in the future. You are learning how to engage with big questions, how to collect and analyze data, sometimes imperfect or incomplete data, and then how to use that to inform change in the world. That skill set is something that is so deeply needed, and your ability to use that skill set for health problems, it doesn't just go into government jobs. It can be applied, again, in the private sector. It can be used in journalism. It can be used in the educational system. So I think part of it is also broadening the aperture of what job opportunities are great ones for people with a degree in public health to go into. I am finding increasing numbers of our graduates who are being hired by Fortune 50 companies to help inform employee wellness and well-being, who are being hired by large tech companies to think about the structure of health algorithms, who are being hired by manufacturing companies to think about worker safety or health. So just expanding, yes, there are things that are being dismantled, but there's also a lot of opportunity out there.
Megan, thank you so much for joining us and for sharing your wisdom, your experience, and your insights. Really incredible to be here with you. And thank you to all of our audience today. A reminder that this will become a video available online on the YouTube channel of the Chan School of Public Health. And thank you again, and good afternoon, everyone.
Thank you. Thanks, Andrea, for having me.